If I think about the big cancer centers in New York, there were news articles about MSK converting some of the cancer floors into COVID response centers. What impact did that have on practices like yours and the community overall in the New York area? And what implications does that have for the role that community could be playing in the future?
I think this was an opportunity where we saw these people who historically had been, I'll say, enemies for a better term, work as friends. We all kind of realized that all the nonsense that had gone forth on a competitive basis for the last couple of years was meaningless when you had patients who needed therapy and we needed to work together better. We were pretty fortunate. We have great relationships with most of our systems to start with. We are a clinical affiliate of both Stony Brook here in Long Island and Mount Sinai in New York City, and we utilized that partnership, and they did especially because they were so overwhelmed. We saw a bunch of their patients migrate over to our infusion centers, and it was seamless for them. I think this was a time where there was great tragedy, but at the same time, we saw something we hadn't seen before, and that systems come together to work together to take care of patients that needed treatment.
It's amazing. Do you think we'll see more of this in the future?
I do. I think hospitals have learned a lesson that they needed to. It was unfortunate to have to come at the expense of lives, but the hospital in New York and across the country have gotten to the point where what they were worried about has been specialty care, anything that drove revenue. What we're seeing now is that they were ill prepared for what they were originally set up to do, and that's to be tertiary care centers to care for sick patients, not worry about primary care, not worry about all the other things that they got so involved in that they weren't able to manage a pandemic that happened. I think this is a reset for hospitals and for congressional legislators to sit back and say, what is our system right now and how should it actually look? What we're seeing is that practices like, New York Cancer, like Tennessee Oncology, like West, we were very nimble and able to take care of our patients quickly, while the hospital systems were overrun and couldn't take care of their cancer patients the way they should have been.
Reflecting on some of the challenges that you were talking about, and also we heard about some of the financial pressures and operational pressures that community practices are facing across the country. How then do you look towards manufacturers? How could the drug manufacturers be helping you during these times?
Again, another great question. I will say the drug manufacturers have stepped up more than I could have anticipated. They really have come forward, and mostly what they've come forward with are better terms for us. Knowing the challenges we're going through right now, they're giving us a longer time frame to pay them for the drugs that we're purchasing from them. That's been life-saving to us. It could be that some grants that some of the other pharma companies are offering, like transportation to help patients. There's a lot of innovation going on right now in pharma on how they can help us help patients. And we're looking to them to work with us on all these different aspects, and we're seeing them come through. So it's not just related to payment terms. It could be a lot of out-of-the-box thinking that's going on right now.
Dr. Vacirca, you talked about how the practices are anticipating to be busier than ever in the coming months as markets start to open up and patients start to receive the elective surgeries and get diagnosis for cancer. What advice would you give to pharmaceutical companies for education and outreach to you and your practice under these times?
Thanks, Sankalp. That's a good question. I think what I'd first tell them is don't give up. We appreciate everything that they've done to help with the crisis we're undergoing right now. We appreciate how they continue to reach out to us to provide education. What I can tell you and promise them as we're able to open up our practice more and we see a lot more improvements in patient safety, we certainly want to interact with our pharma partners as much or more than we did historically. I really want to say thank you to them for what they've done to work with us and to help us get through this crisis. And it won't be forgotten by us on the front lines taking care of patients every day. And we certainly want to continue this long term. this will pass like everything else. We need them to continue to partner with us on education, on assistance programs, on foundational grants for patients, because first and foremost, everything we do is about patient care, and we appreciate their partnership on that.
Great, very helpful. Dr. Vacirca, thank you again for all of your insights and comments here. And a big thank you for everything you and your staff have been doing for all the cancer patients in New York. Thank you.